We have new information on the health of Vice President Joe Biden's son, Beau. He's expected to be discharged from a Houston hospital today after undergoing what's being described as a successful procedure. Dr. Nancy Snyderman is NBC's chief medical editor. Nancy, good morning to
Matt.
you. I'm always careful. We're speculating a lot here, and when we're talking about someone's health.
We are using our language in very guarded ways.
He had a procedure at MD Anderson yesterday, expected to be discharged today. At least that tells us this was probably a diagnostic procedure.
Correct.
As opposed to a treatment.
Yes, we know that he had a seizure several years ago. He has continued to have neurologic problems. Was seen at Northwestern Hospital, then at hospital in Jefferson in Philadelphia, then at MD Anderson. So you put the pieces together and say, okay, it went from finding something to needing a diagnostic procedure. And the word we got was that he underwent a complicated biopsy of a brain mass.
What would they be doing? What would the patient go through during a complicated biopsy? What are they looking for?
Well, they're looking for tissue. Once you see something on a CT or an MRI scan that shouldn't be there, it's called a mass because it's taking up room. Then you have to figure out what it is. Obviously, there was a lot of speculation. Could this have any relationship with what Joe Biden went through 20 years later when he had two hemangiomas, and when he had aneurysms that burst? And the answer is no.
But so, this is an invasive procedure.
It is an invasive procedure.
The vice president said it was successful. Does that mean they got the tissue they were looking for and the patient came through okay?
When I hear the word, it was successful, I hear no complications, resting well, expected to be discharged. When I hear the word complicated procedure, I think maybe a little bleeding, maybe not, but perhaps not getting all the tissue, but a biopsy. Whenever you go in to get tissue, you can get a little, you can get all of it, or sometimes you just have to figure out that enough. In brain surgery, perfection is not the goal. Good is the goal.
How long will it take to get results of a biopsy in a case like this?
If this is an easy thing to read, could be 48 hours. If this is a complicated thing to read and they send tissue out to various specialists across the country, we could be looking at weeks. But we sure do send them our best, and hopefully he really will be discharged this morning.
Absolutely, Nancy. Thanks as
You
always.
bet, Matt.
Appreciate it.